Has India really kept COVID mortality rate under check, as is being claimed? 23% of the national capital exposed to COVID. What does this really mean? And is Delhi, the national capital, past its peak? And are we seeing, therefore, in certain cities of the country, including Mumbai, a gradual decline in numbers? These are some of the questions I will ask. I'm joined right at the very top first by Dr. S.K. Sareen, Director, Institute of Liver and Biliary Sciences, and someone who's been tracking this in Delhi very closely. So let's start with the big Delhi question before I come to mortality questions with Professor Ramanan Lakshmi Narayan, who will join us. Dr. Sareen, do you believe that Delhi is past its peak? For the first time after 2 months, the number of cases have fallen below 1,000. Fresh cases have fallen below 1,000.
Yes, certainly this is a very good trend that we are seeing for last few days, and we had earlier predicted also that July may be the turning point, and it's a very good news. The reproduction number, the numbers, we were close to 4,000 and now we are less than 1,500 for last few days. So it's a very good sign. I think we have probably passed the hump, and if the Lady Luck smiles on us and continues to do so, we should be okay by the end of September, that the numbers are visibly less and less alarming for us.
So what has changed, Dr. Sareen? So what has changed, Dr. Sareen, from Manish Sisodia, Deputy Chief Minister of the National Capital, telling us in the first week of June that by the end of July, Delhi will have 550,000 cases, to today you telling us that the worst is over possibly in Delhi? What has suddenly changed?
Well, I think the models never really show what is likely to happen. Models are only predictions that if nothing else intervenes, like there is no proper distancing or mask wearing, then the numbers would keep on growing. So one infecting two, two infecting another 2.5. But once the things went into real good drive, I think Delhi showed that the infectivity number has gone down from 1 to 2 to maybe 1 to 0.5. So the projections are really just models.
But Dr.
I would say what has really done well.
Yes, go ahead.
You recollect the earlier.
Go ahead.
Yeah, the earlier we had a survey which was done by ICMR for 83 districts in the country. And that was in May, and the results came out in June. I want you to remember that time the seroprevalence was 0.8% across 26,000 people which were studied in India. And if you take that as a number and you take Delhi as a total number, you see now 23% of the people are infected. If you take that rest of the country had 0.8%, maybe Delhi had also 1% or so. So it shows you, and the same trends were seen in UK. UK few weeks in the beginning.
Dr. Sareen, explain that to our average viewer. What does it mean that Sero survey shows that 23% of Delhi is infected? What does that mean?
Well, it has good and bad. First is the bad part. The bad part is that 77% of Delhiites are still risk prone. They can get the virus. That's the worst part of it.
Right.
The good part of it is, if you take the population of Delhi as 2 crores and 130,000 are positive, means about 0.6% of Delhiites actually got infected. But how many got antibodies without getting a vaccine? So you have 23%, 1/4 of Delhi almost got immunity, almost, from the virus without suffering. This was subclinical. This is herd immunity. So they never got the vaccine, but still got the antibodies. And these antibodies, of course, they have not been titrated. The question remains whether they are protective or not. But presence of antibody means they were exposed and they cleared the virus possibly. But it leaves us with many questions. Tomorrow, should these people who have got the antibodies, should they wear the mask or no mask? I would say wear the mask. You can get reinfected. Second question is what Germany had done, that if you have these antibodies, you have a passport, you have a work permit. You can travel to another country. Can India give that permit? Can you say that these Delhi people can go to other places? No. Third, and very importantly, is you are starting vaccine trials. those people who already have antibodies cannot be enrolled into the vaccine trial. So we need to be sure that. Now, another question is the sample size. We did about 21,000. It's a huge sample. You take UK, you take US, they almost take the same sample size. So the sample size is representative. But what we need to be sure that Delhi is over the hump and Delhi is getting protected is that in the same region, not necessarily same people, in the same region, today it is 23%, tomorrow it becomes 35%. Tomorrow means another 4 weeks or so. Then we say, okay, gradually we are moving towards an immunity in the absence of a vaccine, in the absence of science, in the absence of going to a hospital.
Right. Let me
I
take
hope
that.
it is simple now.
Yeah. No, I think you clarified it to a viewer. The only point I have is, how do I know that I have the antibodies? How do I know that I have the antibodies and therefore I have achieved herd immunity? How do I know that? How do I know I am in that 23%?
Yeah.
Let me take that.
Well, I'm sure you are not as of now because you have not been exposed. But for a common person, you need a blood test. Okay. This blood test, see, for the virus, you take a nasal swab. That gives you the virus which is multiplying in the nose, in the mucous membrane of the nose.
Right.
But for the antibody, which is body making it, you have to have a blood test. And this blood test will tell you, well, you have the antibodies and they are protective antibodies or so.
Okay.
So I think blood test is a simple test you can do in thousands, and it's a very simple test. Another good part of this antibody test is it gives you confidence that yes, our measures have been successful. How will a government know that, or how will a policy maker know that wearing a mask has helped or not? How will you know that this is a vulnerable area? There are questions, people ask me in the day, well, are the elderly people still, do elderly people make same amount of antibodies? Do children make? Yes. The children and the adults, they make same quantity of antibodies.
Let me just take all these points. Let me take all these points to Professor Lakshminarayanan. Professor, you're looking at, and you've been talking about the fact for the longest time that a far greater number of people are infected than the numbers that are being put on screen every night. Now the government is saying the Sero survey in Delhi shows 23% of the national capital of the country is infected. Therefore, the actual number of people who should be infected should run into millions. Is this good news? Is this good news? Are we reaching some level of herd immunity?
So Rajdeep, let's lay out the numbers. So the government survey would indicate that something like 4.3 million or 4.4 million people in Delhi have been infected in the past, sometime between March and right now.
Yes.
Right? So that's a vastly greater number than we've been led to believe, because as we've said repeatedly on this show, the numbers that we have are reported infections. They're not the true numbers of infections. Now let's go by Delhi's death count of 3628, which is, today's death count is 3,628 people who have died in Delhi. Now that would indicate an infection fatality rate of 0.08%, which is actually lower than regular flu, which would be about 0.1 or 0.2%. And it's completely inconsistent with any other data in the world. So even if you were to assume something like a 0.3% fatality rate, which is extremely low by any global standard, it means that we are undercounting deaths by a factor of about 4. Okay, so that's the first thing. We are undercounting deaths. We've known that for a while because, media, channels like yourself have shown that bodies are piling up and no one's actually counting them. A lot of people don't get the COVID test. So this gives a lot of support to the fact that, there is an undercount of about 4x. The second is, of course, that, as Dr. Sareen just said, there is a good news that we have a lot of people who have already been infected. This was predicted back in March itself. It's very hard to contain a virus like this in a population like India. We do our best, we wear masks, but it will still rip through the population. And this is what we've said consistently going back, quite a few months, and this is what we will see. Now, I don't know if that 23% number is exactly right, because the government has not released any data on who was surveyed, how many were surveyed. I mean, of course, we know how many were surveyed, but we don't know what is called the sampling frame. Now, the data that I've seen from other parts of the country are much lower than this. They're more in the 1 to 6% range. I have not seen any state level data which comes anywhere close to 23%.
No, but what could it mean? Could it mean that a number of people were asymptomatic over the last few months, got infected, didn't have to go to hospital? Would it also not therefore mean, if these numbers are right, that maybe mortality rates in India are even lower than what we are saying? 2.4% is official, but you don't believe that, right?
I don't believe the 2.4% at all for a minute. I think that's way too high, first of all. I think we're doing ourselves a disservice by thinking we have a 2.4% mortality rate. Our best estimate, and we just published this in a few days ago based on data from Tamil Nadu and Andhra Pradesh, our estimate is that it's more like 0.9% for India, which is actually quite consistent with what you see in France and other countries. It's definitely not 2.4, which is way too high. Now, let me also tie this, Rajdeep, although you didn't ask me this question, to the Oxford vaccine trial. Now, if you might, that trial basically showed that people who got the vaccine, it's a adenovirus, enabled vaccine, that they developed antibodies, and a lot of them developed what are called neutralizing antibodies, which is antibodies that actually kill the virus, so useful antibodies in that sense. Now, all of these add up to a consistent picture, which the Chinese had confirmed 3 months back, which is that having antibodies were protective. Now, the Chinese actually used to use this kind of an immune passport that Dr. Sareen just mentioned to allow healthcare workers who were already infected and had gained immunity to go out and be on the front lines, because the chance that they would then get infected and die afterwards was much lower, and therefore they used it as a way of protecting healthcare workers. We have not yet done that, but we really should use this antibody information much more intelligently than we have. I think we're still stuck with thinking, well, antibodies are not protective, et cetera, et cetera. Now, in the Oxford study, they found that this vaccine actually produced neutralizing antibodies, and in fact, the production of these neutralizing antibodies was greater when you gave people more doses of the vaccine. Now, all of this adds up to a fairly consistent picture with what we know about coronaviruses and viruses in general, which is exposure does protect and does give you some amount of protection from reinfection, at least for a few months, if not for a couple of years. That's very good, number one. Number two, that means that we can actually develop a vaccine for it, although I would hesitate to say that this Oxford vaccine is necessarily the one that will get through, because phase 1, phase 2 is 600 patients. And when you have to do it in phase 3, that's thousands of patients, and we have no idea what we might uncover at that time. So if not this vaccine, some other vaccine will come through, and that's good news. So I think overall, I would take today's developments as good news that the antibodies are on our side, that we've got a fair amount of immunity, even if we were to say that maybe this is exaggerated a little bit, maybe it's not 23%, but overall we are hurtling towards this end state of potential herd immunity, and having the vaccine will help us get there even faster.
That's therefore Professor Lakshmi Narayanan and Dr. Sareen are in a sense giving us both sides of the picture, giving us the positives also that exist in these numbers, as well as putting in certain caveats and warning signs. But at least broadly speaking, if these numbers are anywhere close to being close to the reality, maybe, just maybe, a number of people out there are developing the antibodies that are required so critically in this fight against coronavirus. Dr. Sareen, Professor Lakshmi Narayan, I appreciate your joining me here at the top of the news here tonight.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.